Excellent. Well, while people are joining us, I was thinking it might be nice to sort of reintroduce ourselves, or just update each other on how we're all doing, how the week's been, and just, I guess, have a bit of human connection that we all seem to be missing during our normal weeks. So maybe if we can maybe start off with our name, probably maybe the highlight of this week for you, and the place where you wish you could be right now. As I'm sure there's many places. Rajiv, I might get you to start off. Is that okay?
Sorry.
Actually, whilst Rajiv's sorting out his tech, maybe I'll ask Puneet to start off then.
Okay, I think asking where you would most like to be is a very unfair question, because we can't go anywhere.
That's true. That's true.
Yeah. But I think I'll be happy with a bit more mobility, and our favorite place is Nelson Bay. If I could be anywhere in the world, I would probably just go to Nelson Bay, because the weather is beautiful, the spring is approaching, it's really nice outside. So I would like to go and be at beach somewhere. Yeah, that would be the thing. What were the other two questions?
And the highlight of the week for you. So what a good thing that happened this week?
The highlight of the week is, I don't know, it was his birthday last week. He just reminded.
Congratulations. Happy birthday for last week.
Yeah.
How old are you now?
How old are you now? 9.
Oh, almost in the double digits. Very exciting.
Double digits very soon. Yeah. Okay. So somebody wants to have a go at where they would like to be. Charishma, how about you? You tell us what was the highlight of your week, and where you would like to be the most at this stage, if you could be anywhere in the world.
Probably the highlight of my week was going for a kind of scavenger hunt walk yesterday. So if anyone has seen the Liverpool Council Instagram page, there's a really cool sort of outdoors bingo that you can try. So you can go for a walk, and it gives you a list of things that you take photos of. So I went for an outdoors walk yesterday, which was quite fun. And where I would most like to be right now, why not South America? Choose some sort of exotic location where none of us can be. So that's probably where I would like to be. I might pass it off. And you know what? So when you're finished your questions, then you can select someone to pass it on to. So someone that hasn't spoken yet, you can select who goes next. So I'll pass it on to Kanmani Auntie.
Oh, hi. Highlights. Okay, highlight is my daughter's birthday last week, where I wanted to be. Like, I want to go to India to see my mom, who is not well. Yeah. So yeah, but I'm just going, like, I have to be at home another 2 months at least, as per Premier's announcement, at least up until October 25th. Could be longer, we know that. I don't like to be at home, but I have no options. Okay, well, I have to say, so choose someone. How about Banu? I just don't know many people, so Banu, you can say something about your highlights and where you want to be.
I've been working all along. I haven't got any break at all. So I think the unfortunate one, because I work in the same LGA. So rest of my colleagues, they're all off because they're all from the different LGAs. And since I'm in the same LGA, I have no exemption or anything. So a bit upset about that, but it's okay. So something to look forward for. I can get out and refresh myself, I suppose.
Are they going to days off because you've been working the whole time?
No days off at all.
You must put forward a request.
No, I don't know.
Because you're working all the time and it's going to be another couple of months at least.
But
Yeah,
anyway,
have
my
a break.
annual leave is coming up in the end of October for 6 weeks.
Okay.
So yeah,
Yeah, good
looking
luck.
forward for that.
Yeah. Okay, maybe you can choose someone now because I don't know many
I
other.
can tag who's on. I can tag
For difficulty in the qualification campaign, to compare.
Avi Desai. Avi? Yes.
Hi.
Good,
So
yeah.
Avi is my English name. I'm Bhargavi. Hello, everyone.
Oh, Bhargavi. Okay, Bhargavi. Beautiful.
Yeah. So highlight of my day definitely is this because this is the time where I'm seeing so many faces at the first
Oh,
time
that's good.
in the week.
Yeah.
Yeah. I'm from Melbourne, but we have strict lockdowns and I live by
Beautiful.
myself. So that's not a great situation. But yeah. A place where I'd rather be would definitely be at the restaurant eating wood fire pizzas. It's Sunday, yeah, but here we are.
That sounds so nice.
Oh, it tastes nice.
Avi, would you like to share your vision and what you're planning to do at the end, maybe at the end of the forum? We would
Yeah, I
like to.
think that would be great. Puneet, as well. That would be a good opportunity. Maybe at the end,
Yeah,
if it
that would be.
suits everyone and as well.
Yeah, I would like to hear what you planning to do, what you guys are up to.
Yeah, thank you. I will choose Harini Lakshmi to go after me.
Hi, I'm Harini. Oh gosh, so the highlight of my day or the week is probably going for a walk in the park and coming across a few puppies that just wander up to you and say hello. I'm missing my dog at home, who's with my mum and dad a lot, and I haven't seen them in a few months, so that sucks. Where I would rather be is preferably in India with cousins, but that's going to be a while. But yeah, that's the hope. One day we get back to normal. I will shoot it to who hasn't had a go. Well, actually, I see Dr. Gopinath on here, so I'm going to shoot it to Dr. Gopinath.
Thank you again after a long time. I am new to the forum and Hari used to be my student. So I'm that old. In fact, he was my first year student, right, Hari?
Yes, that is correct.
Yeah. So I won't forget, she was my first year, first batch. So that's my highlight, I guess, today. Seeing Hari again after however long that was.
It's been a few,
A
almost a
coming back,
decade.
Yeah. That's been how long it's been. Where I would like to be, I think I'm a little boring that way. I've seen a lot of COVID in the hospital and I'd love to be where there's less of COVID. We're seeing a lot. I work in Campbelltown Hospital. There's a lot there. So we're all trying to cope with it. And so going there where we see the end of it soon, I guess that's my bit. I see Saro Auntie. Saro Auntie, you next, please.
Hi, everyone.
Hi.
Hi, Sumana. The highlight of my the last week was for me, unfortunately not there, but in Sydney, and our first grandson's 18th birthday. So, but luckily we had a Zoom call from my daughter with us and our son, who is at the moment in Croatia, holidaying from the UK. So that's where I would have liked to have been, because we haven't been to Croatia. So, the UK is living with COVID. So they are allowed to travel, have holidays in countries that are termed green. So Croatia happened to be one of them, and that's where they've gone. So I would love to have been there, because we haven't been. We are good travelers, but we haven't been to Croatia. So, Rajiv, we haven't heard from him. That's who I'd like to tag now.
Thank you, and good to see all of you. Well, highlight again, I suppose a little bit similar to Sumana's in the sense that we're in the thick of things and doing our best. And I suppose the highlight is that that at work we were able to I suppose prevent a number of children from coming to hospital by continuing to be able to see them at home or see them at whichever placement they were in, and prevent their hospitalization, and thus the chance of the risk. And I suppose the low light was that there are a number of different kinds of patients who attend the hospital emergency departments and find out an hour later that they'd been sitting next to a patient who's unfortunately returned a positive test, and so therefore they're a close contact and need to isolate one way or the other. So it is quite a significant situation at the moment. And where I'd rather be, well, yes, there are lots of places I'd rather be, but I think where I am is where I'm meant to be, and doing the best what I'm able to do is what I'm meant to do at the moment. So yes, I'm quite comfortable where I am, and yes, where you know, as the situation evolves, I'm sure there'll be a number of different places that we can go to. And again, a warm welcome to Sumana and also Harini, first time. A number of others are quite familiar, but it's really good that the two of you have been able to make it. And who should I tag? Who is Dhruv? I'll tag you.
Okay. Hello guys. I'm Dhruv. One place I'd like to be, anywhere outside my home right now. Been seeing a lot of this. Maybe friend's house. I'm not sure. And a highlight for this week. Yeah, it was my brother's birthday. A couple of days back. So it's probably the highlight. Tag. I don't really know anyone, but Neil, I'll tag him.
Hi, Dhruv. Hi, everybody. This is Neil. Nice to see you all. This is definitely one of the highlights, being able to see the lovely faces of everybody, and having an open chat like this is excellent. So this is one of the highlights. Besides this, we also managed to get a spot for my daughter to get a vaccine, her first jab, which we have been trying, and finally we managed to get one. And when we did manage to get one, it was quick. The very next day we were able to find a slot because we happened to be in one of those priority LGAs, so it worked in our favor that way. In terms of where I would like to be, definitely, you know, it's been a long time since been to India, so all my family and friends live there. So, you know, would have liked to be in India, you know, having a good masala dosa and coffee somewhere there, nice one. Yeah. And separately, Rajiv, how did you manage to keep your hair so close? I mean, nicely, you know, cut in spite of the lockdown.
I have a surprise.
Is it self-help?
We're all multitasking.
Excellent. I got to learn that trick. Chiran's got a mountain on his head, and he wouldn't let me touch it. Yeah, let me tag. How about Sashi? Why don't you go next?
Highlight for my day. I've had an exciting day today, starting from 6 o'clock, listening to about 20 kids chanting Aditya Hrudya for the COVID reason. So this was organized by Sydney Sanskrit School. So it was a blessing to be there from school, and it was all junior kids, like, you know, from the age group of 8 to 15 who chanted, and it was excellent. And the speed that they did, they've all together with the number of participants. So we did Aditya Hridayam for about 1,000 times. plus, in fact. So that was the highlight for the first part, and the second part was the Sankalpa thing, Zoom thing that we had from HSS. That was another excellent. Of course, my daughter's in HSC, and Yagavan started high school, so it was a very knowledgeable program conducted by the Yuva team. So I've had an amazing day. I think not to thank COVID, but the Zoom technology, which has actually brought us together through this technology, I think. And moving forward, this is the third thing I'm attending. So happy to share this. And where I would like to be, of course, getting out of that house and enjoying a day out in the sunshine is perfect, apart from just my backyard or just around the house. Okay, who am I passing it on? I'm sure most of, I joined late, so I'm not sure who is. Did Shobha have a go?
I don't think so.
There we go.
Hello.
Shobha, your turn.
Hi. Hello. Hi, everybody. Sorry, I'm driving, so that's why my video is not on. And I've got a mask on. So I've just ducked out to do some shopping. Can you all hear me?
Yes.
Okay.
Yeah, we can.
Sorry. Yeah, I just had to do some emergency grocery. So I have the luxury of just ducking out for a few minutes. Yeah, highlight of this week, nothing much for me. I'm working from home. So it's work as usual. Yes, it could have been better. Yeah, I could have done so many other things. Nothing really exciting for me for this week. So give that a pause. Where I would be, so many exotic and nice places, but I'm really glad, like I'm really safe and sound at home. So, and I'm grateful for that. So that's it for me. So I might tag, who else? Oh, Vani, Dr. Vani. Yeah, I don't think you had a go. So off to you. Thank you.
Hi, I think my highlight is taking part in the Sankalp program this week. That was it was nice to see a lot of young people, and that was a highlight. Another thing I would say is where I'd rather not be at the, I too have had a lot of COVID patients, and I have to thank Dr. Sumana. She helped me connect, with one of my patient's father who was sick in ICU. So I really want to thank her for that. So we've had another, as Raji was saying, one of our staff member was positive for COVID, and I seem to have missed out again. So I'm not in isolation, but a lot of our staff are. So working in general practice with hardly any, where the director is manning the phones, it's a very interesting experience. And where I'd rather be, I'd like to go and visit my mom's house other than just drop the kids. It's just down the street, but I can't go in there. So who else is? Raghu?
Yeah, namaste. I'm Raghu. I work in Liverpool Hospital Eastern Campus. So I've been working right through, and there's no work from home for me. So the highlight would be, it's a bit strange. My daughter gave me a haircut. She's 12, so it's not bad. Not much of hair left, but still, it's not bad for whatever she's done. And the other highlight would be, I just went for a 10-kilometer run and walk this morning. That's pretty much. And where I would like to be on a Sunday, at the moment, I'm missing my crickets every morning. So I would rather, and the other obvious I would be being in India. So that's pretty much. And I'll just tag in Jay for the next one. Jason?
Evening all. The two questions. The first one is my highlight. I think for us though, Janmashtami is for everybody. Janmashtami is tomorrow and day after. It is quite a big event for us from a festival perspective, just preparing the goodies to God and involving kids to be a part of it. I suppose it's an exciting time. I do probably the manual work of washing and getting things from the shop, but then just watching my daughter get involved is kind of an exciting thing because it's kind of passing of tradition. Where would I rather be? I'd rather be. I think I'm thankful to where I am at the moment, but more importantly, because the kids are with us almost 24/7, I'd rather be anywhere where I can actually get a decent day without the kids being around shouting and on of us. So that's what it is, and that's just a tongue-in-cheek comment, though. But yeah, look, I'm really thankful to where I am at the moment. I would pass it on to VGG.
I think she may have dropped out. So does anyone want to volunteer to go next, or I can choose someone? Yes, Yashasvi, you can.
Hello everyone. Highlight for me, I started work at 5:30 today, which is not something to look forward on a weekend, but I was really excited because we usually do a weekend dance routine. So I was excited to do it with my sister. Yeah, I would next. Should do.
The destination.
Okay.
Second part of the question.
Neela. Thank you.
I think.
Yeah, I think Neela's spoken already.
So I think Narayan Uncle has not spoken before. Uncle, would you like to?
Jason has not spoken as well, I think. I just read. I'm looking at the names.
I think Jason may have just spoken now.
Oh, okay. Sorry.
The last one that I can see that I have that I don't think we've heard from is Lakshmi.
Lakshmi, yeah.
That's right. If you're having connection issues, you can share in the chat. But we might move to, I guess, hearing from different people about their perspectives on, what's happening at the moment, and just sharing maybe how things are from their end. First off, we have Dhruv, who is going to share a little bit about his experiences as a student at the moment. Dhruv, would you like to take it away?
Yeah, let me just share my screen really quickly.
Yeah, sure. I'll put myself on mute.
Okay. Can you guys see that?
Yes.
Yeah.
Okay, cool. Okay, so hey guys, I'll start off with introducing myself. My name is Dhruv Bharadwaj. I'm 9, 14, and go to Trinity Grammar School. I'll be talking briefly about the pandemic, but mostly about a change in my lifestyle. So recently, as we all know, an outbreak of COVID has occurred in New South Wales, sending the state into a government-instigated lockdown. My school, like many others, has gone into online learning. So this choice was originally made because of the risk for students' parents rather than the students themselves, and issues with students contracting and spreading the virus to their homes to people more at risk than themselves. So according to the Australian Government Department of Health, common medical illnesses and diseases that put people at moderate risk were diabetes, asthma, or any heart disease, and older people. So as a person's age goes up, so do their risk. as well as smokers. Okay, so during this time, vaccination rollout increased with more and more older people getting the jab. However, with the recent breakout of the Delta strain to Australia, those risks have flipped on our younger population, and the virus doesn't distinguish between ages. For example, high school students are equally as at risk as the older population. The risk has fallen on the younger population, as the majority of older people have already been vaccinated. Due to these new factors, a few days ago, the government opened vaccination bookings for ages 12 to 15, which included me. Now, while we wait for Australians of all ages to be fully vaccinated, I'm stuck behind the computer screen 6 to 8 hours a day, just attending classes.
Erasable. Is that what you want?
These 6 to 8 hours doesn't account for the homework, tests, and assessments piled on as teachers perceive us students as having more time on our hands. So because of online learning, there's been a shift in education becoming purely academic. Before, in a normal school year, I would usually have access to co-curricular activities, sport, gym, but because of lockdown, I don't have access to any of these facilities. Outside of school-based activities, I've noticed a significant change in my lifestyle. So generally a major decrease in physical activity and increase in screen time. So I'm a very sporty person and enjoy playing a lot of sports and watching a lot of sports. It was quite disappointing to see that my rugby season got scrapped for my school, and even more disappointing to hear that the cricket season might also be called off. So to make sure I maintain a good level of fitness, I do very basic physical activities such as lifting weights or doing a few push-ups or crunches. So I found basic amount of physical activity can go a long way if you're consistent, and hours cooped up in front of the screen should be balanced out with some sort of exercise, whatever that may be for different people. So the next lifestyle change was big difference in screen time. Outside productively stimulating screen time as means for entertainment can go out of hand really quickly. In lockdown, every day feels the same. It was my brother's birthday a few days ago, and before he cut the cake, he said, "It doesn't feel like my birthday." So I asked him, I was intrigued. I said, "What do you mean?" And then he said, "It feels like just another normal day." And I thought this was so true. And it's really easy to while time away being unproductive on a device and doing nothing for yourself. 1 week, my daily average on my phone was nearly 8 hours spent on calls and Instagram and games, but it's still a ridiculous amount. And I realized it was a serious problem and I need to tone it down a lot. And so here are a couple of things that I did, and this might be able to help anyone with managing their screen time. So the first thing I did was have a period of time completely screen free. This may not work for everyone if you have important calls or emails to respond to, but having 3 or 4 hours completely away from a device is really, really helpful. The second point was getting outside the house and leaving the phone behind. So whenever I left the house for a walk or a bike ride, I usually listened to music and took my phone with me, but I still found myself responding to texts and scrolling through Instagram, even though I was outside. So being outside and away from a screen can be really refreshing and a good break from the monotonous routine of lockdown. And the third thing was replace screen time with a hobby. So for example, I've been cooking, making my family dinners every now and again, and reading a lot more than I used to. Hobbies can also include drawing, doing crossword puzzles, or maybe even playing board games with the family. To finish off, I'd like to address the social challenges of lockdown that I, and I'm sure many others, have been facing. A great way to stay in touch with friends is talking to them, either over the phone or other networks. Something I've been trying is, instead of watching Netflix on my own, I've been using this thing called Teleparty, where instead of watching it by yourself, you can watch it with a friend. Or if you like to watch movies by yourself and maybe substitute for some younger people, maybe playing video games with your friends. Now, lockdown has incurred a drastic change in lifestyle, but we shouldn't waste that time spending hours in front of a screen and still maintain meaningful relationships while we wait for life to go back to normal. Thank you. That's all I have. If you guys have any questions, yeah, that's it though.
Thank you so much, Dhruv. That was fantastic. I know I definitely struggle with way too much screen time, as my mum will no doubt mention shortly. And you've actually put in some really handy suggestions in terms of limiting screen time and that sort of thing. Does anyone have questions about any of the things that that Dhruv has spoken about? Anyone want to share their experience, whether it's with screen time or something else?
I want to know what Dhruv cooks for his family.
So a couple of days ago, I made I think it was, what was it? I made some fish. I think it was for my brother's birthday. I can't remember, but yeah, I made some fish. It was a Barca fillet, and then I made this salad. Can't exactly remember what it was, but yeah.
That's awesome. In the chat, Dr. Gopinath has thanked you for mentioning the concept of a telly party. And I also have to share, it was my best friend's birthday earlier this week, and she and my other friend live interstate, and so obviously can't really see each other. So we had a telly party via WhatsApp, and there's also an app called House Party where you can play games, you can do things like Trivial Pursuit and things like that with a small number of other people as well. So if that's something that is, will help you connect with friends who may live overseas or interstate, then that's handy.
Thanks for doing it, Shari, for my daughter. She just told me she enjoyed it so much.
Oh, I think we all enjoyed it, Auntie.
Yeah.
Much needed.
Yeah.
And there is Netflix Party as well. I find that that's very easy, and you can watch a movie with your friends, and you can download an app. It's very simple to do. And then you can chat with your friends on the side while you're watching a movie, like commenting on something and stuff like that. So for people like me who don't play games, that is very handy. Although I've never gotten the chance to do that. I've been busy. With kids at home, you've got more work. Mums have more work than before. So that's another thing. I actually wanted to pose a question to people about, we've been talking about negative experiences and increase in screen time and trying to struggle with keeping our hands off pantry and stuff. A lot of people I've spoken to, they relate some positive experiences as well with regards to lockdown. Some people say that they had more time to reflect on certain things. A few people, they just picked up on old habits and stuff. If anyone wants to share something that happened with them on those lines, they're welcome to share.
I saw Minanti's hand up. Minanti, do you want to share?
Yes, very sorry, I entered very late. I had another one meeting with CGI. Very sorry for that one. Yeah, this lockdown is really, really good for us. Good for me, especially, I'm saying. Because though we hosted a wonderful camp for our senior students for Sydney Sanskrit School, as you all know, that is a Sanskrit community language school. In that, what we did, early morning classes we started, that is 6:30 to 7:30, 1 hour learning Sanskrit. In that, we wanted to cover all the grammar, make it as a more fun. And because of this increasing lockdown time, I thought of introducing a very special prayer for the sun prayer. It is called as Aditya Hridayam. And nearly 6 to 8 weeks, kids learn so efficiently all the nearing 31 shlokas. And today morning, group of nearly 120 people gathered on Zoom, and 20 students, they presented. Altogether, 1,000 times we chanted, altogether, everyone including. That was really fun, and all the 3 Pandits came, and CGI Cultural Center, Ramanan Gargji, he was in the meeting, and he blessed the occasion. Not only that one, even over India, from India, I talked to my relatives. We have so many exchange of thoughts, so many online learning we do. For that, screen time, where you can use is most important, how you can use is most important. Just only for the games and unmonitored or unsupervised is not good. So there should be some target. And see, for the Australian COVID relief, this Aditya Hridayam was chanted by all the people. So there should be some motto for all your learning, the outcome, what we can say. Yeah.
Thank you, Minanti. I see Bhargavi's hand is raised, but I also see that Anya and Dinakarji have also joined. So if you would like to say hello, introduce yourselves, would love to invite you to say something, Anya and Dinakarji. If not, we'll just move to Bhargavi.
Yeah, so I'm a professional psychologist at high school, and what Ruth said was very relevant to the kind of presentations I saw. And one thing that I find that I was able to help some of my clients was having some family time, like playing games together, cooking together, and that kind of family building would solidify over lockdown. And that was something, you know, kind of trying to reconnect with your family again, especially with teenagers and their parents. There is some gap, but lockdown has given this opportunity for them to be under one roof and know each other a bit better and know their culture a bit better. So yeah, that's what I wanted to say.
Yeah, no, that's a really, really important point as well. So if anyone has any, you know, questions or things that they would like to share, you're welcome to put them in the chat as well as share them, you know, by raising your hand. I also wanted to bring in Dr. Harini here because I know from speaking to a number of people, obviously, you know, COVID and all of the particulars of that situation has really grabbed most people's attention when it comes to healthcare. But obviously it's really important for us to still maintain our engagement with our GPs or, you know, think about other aspects of our health as well. So Harini, would you like to share your experiences and what you've been hearing from your patients and people in your community as well?
Yeah, sure. So just for a little bit of context, I am a GP who's been working in the inner west area for almost 2 years now. So in terms of things that I'm seeing, the biggest thing you see is mental health. As a GP, everyone is coming to this stage where, you know, we're in lockdown for almost a little bit over 8 weeks now, and it's starting to get to people. You're no longer having the social interactions you usually do. You're not seeing, you know, you keep in touch with your close friends, but acquaintances, you're not running into them. Simple things like having a coffee with a friend are no longer allowed. You're always worried about work. There's lots of concerns. You're worried about your family. So mental health is a big thing. And I found that there's been more of an openness to discussing it. And I've had a lot of people come to me, usually at the tail end, and going, I don't know what to do. Like, you're my last point of call. I don't know what to do, don't know how to do it. And that's what you've got to do. Go see your GPs. My biggest tip for today is find yourself a GP that you like, that you gel with, because if you don't gel with them, you're not going to get anywhere with them. You're not going to open up to them. So my biggest tip, if there's anything that I can say, is go find yourself a GP that you like, you trust, and that you will willingly tell things to. You may have to go through a few GPs till you find someone that you like. You may go for a male GP, you may feel more comfortable with a female GP. Find yourself a GP because you want someone that you can stick to for a few years at least. The other tip that I would have is, in terms of looking after yourself, there's a lot of preventative healthcare that's missed by a lot of people, because they go, oh, I put it off because we went into lockdown, then we went into another lockdown, and then 18 months later, I still haven't done the blood test that I was supposed to do 2 years ago. So GPs are still available. They're just available in a different way. So you might just have to do a telehealth consult. A lot of them are still doing telehealth consults, even though physical options are not there. So get on the phone, have a chat with them, say, look, I'd like to check in and see if there's anything that I'm missing, because once you're over the age of 50, we like to do some blood tests. As women, there's women's health issues that need to be addressed. Teenagers need to see a GP, get comfortable with seeing a GP and seeing a doctor on your own. We're not going to go and blurt out your secrets to your parents, I promise. We're legally not allowed to do that as well, so you can sue us if we do. I'm not sure what I didn't really have too much prepped, but I'm going to open it to the court and say, have you got any questions for me? Other than, mental health is a big thing, preventative health is another big thing, and don't put things off. GPs are still open, we're still doing telehealth. Sure, we can't do everything, but if there is a patient that has something that I see over the phone, I usually bring them in for a face-to-face consult. So the rest of the stuff I'm going to put out to the field, and if not, then I'll, Cherry did ask me to talk about things that you could do with screen time, but I feel like Dhruv beat me to that, and Avi had some lovely things to do with family.
I'll ask a question. It's a very general kind of question for all of us to know. That everyone is impressing a lot upon getting tested the moment you see the first symptoms of COVID-19. So they're talking about even if you have like if you're pre-symptomatic, even then you should go and get yourself tested. Would you have any, would you just maybe give a list of things that we need to be vigilant or aware of just to?
Yeah. So my tip is COVID symptoms can present very much like your common cold and your common flu, all right? And respond differently. People have milder symptoms and don't realize, and often they're what we call asymptomatic, so they have nothing, no signs, nothing at all. So if you feel like you're starting to feel unwell, even if you've just, even I know spring is coming up, and if you start sneezing and you're having a cough, I've had a lot of patients go, oh, it's just hay fever, it's hay fever. And I'm like, just get tested. The only person you're not hurting anyone by getting yourself tested. Yes, it's uncomfortable every time. I've had tests done almost every 3 days for a few weeks now, and I cry every time. It's fine, right? Get tested, because by getting tested early, you're out in the community a lot less. You're less likely to pass it on to your loved ones. You're more likely to be identified sooner. The symptoms to watch out for: runny nose, sore throat, anything that affects the respiratory system, so the lungs. So if you've got a cough, you got a fever, a runny nose, a sore throat, you have a headache, you feel like you're getting a flu, go get tested. There are some other vague symptoms that are associated with it, like diarrhea, but if you think that you've got like a cold coming on, go get tested soon, so that they can find you sooner, so that you're not in contact with as many people. And if you live in a household, at least they can take, say, to your loved ones. Okay, you don't want to be passing it on, especially to people who are at home, who are probably not vaccinated yet. The vaccines are out.
Thank you. Thanks for your answer. One more question. Recently, I got a message from a friend where they said that the government has opened up enrollment for 12 to 15 year olds, and there was a link sent later on. We got a message from New South Wales Health saying that they've cancelled our appointment or booking, and it'll reopen from the 13th of September. So a lot of people had a lot of different justifications about why that happened for a brief period. And one of Dhruv's friends, he actually got registered for the same day and went and got vaccinated as well, while for some others it got cancelled at the last moment. I'm just curious, it's not a very relevant question, and I don't expect you to know the answer if you don't know, but I was just because
There is a lot of misinformation out there, a lot of mass messages going around. At the current moment, and I might be wrong in a day, because the advice, I've had patients come up to me and tell me, oh, I'm eligible for the vaccine now. And lo and behold, I go and check and they're like, oh, yes, you are eligible. The information comes out to us slowly trickling. As far as I know, up until now, we're vaccinating those between the ages of 16 to 39 in the local government areas of concern. If you are, we are vaccinating those between the ages of 12 to 15, and in my clinic, we are doing Pfizer vaccines, but in order to be eligible for those Pfizer vaccines between the ages of 12 and 15, you have to have an underlying chronic medical condition that puts you at increased risk.
Yeah.
So the people that I am vaccinating are the ones who've got leukemia, who've got underlying cancer, who've got underlying type 1 diabetes. So they're people who have underlying heart conditions who are at risk. So we're obviously prioritizing them. I'm sure that, you know, in a week or two, it will open up to those between the ages of 12 and 15. And as parents, it's really scary and terrifying when you hear about all the statistics and the numbers of children who are getting these infections. So best advice at the moment is keep your eyes open, listen to the New South Wales government websites or the Australian government websites, rather than just going off the hearsay of SMSs that seem to come through. Check on those websites, and there is a vaccine eligibility checker that you can jump on and check out. For the people between the ages of 16 and 39, you can get vaccinated with if you live in the LGAs of concern, with the Pfizer vaccine. There is if you jump on the vaccine eligibility checker, that will redirect you to the vaccine hubs, but you can also there's also links that are going around where so yes, they're on the cards, just we're not doing them at my clinic at this point in time.
Can I also bring in Dr. Gopi?
Yeah, Bhargavi probably has a question. Sorry not to cut you off. Please go ahead.
That's all right. If we are running short of time, I think we can continue with the planned webinar.
No, just in relation to the question from before, Dr. Gopinath has obviously been kind of in the thick of it, dealing with lots of people who have tested positive for COVID at Campbelltown. So I just wanted to see if she wanted to add anything or add any insights in response to the question.
Okay, thanks. Yeah, that's a good point.
I work in Campbelltown Hospital here. I haven't been in the front line until last week. I'm actually a neurologist. So the bulk of the work was carried out by emergency, ICU, and respiratory physicians. But the demand has become quite a bit more. So there are several of us who've gotten into the thick of it. And so I had my first shift last weekend. And for lack of a better term, it was just horrifying to see young people go into it. The symptoms, like Harini has already said, isn't any different. Anything remotely respiratory, yes, please go get checked for the very same reasons that she's highlighted. We don't want others to go through it. And so it's better to over-investigate. It's not easy. I had to have a surveillance swab, and it really took me 70 hours to get the results. And I'm thinking to myself, by then, if I've really caught it, I've well and truly spread it out. So if there's remotely any chance that you're exposed to it, then isolate yourselves, even if it means you're taking 2 days of isolation without need. It's still better to do it that way. And apart from anything respiratory, diarrhea is sometimes commented about, so that's something to watch out for also. But the truth is, there are youngsters coming in. I think we've come to a stage where we say, if they're too old, then we know it's going to be a bad outcome. And the vaccination has targeted the older ones. So we're seeing a lot of middle-aged ones. It's quite bad because we are seeing a number of them from a non-English speaking background. Communication has become a big effort. It's difficult because we can't communicate with them in the hospital because we don't know the language. But the problem is even trying to use smart devices, we're having problems communicate with the non-English speaking family at home too. There's a lot of help going on. Everyone who's working in the thick of it is doing their job beyond the duty of call. Everyone together. I'm talking about medicos, the nurses, and the social workers. There's tremendous effort going there, but it seems to be insufficient. So I don't know if I answered your question, Charishma, but symptom-wise, everything Harini said, I'd second that. And it's bad out there. I know I'm painting a grim picture. Sorry about that.
No, thank you for sharing, and it's really helpful to see, I guess, what it's like from that perspective as well, especially, you know, being not too far from Campbelltown. It's very obviously close to home for me. So thank you very much for sharing.
All the ones we're seeing in Campbelltown are the ones who overphoned from Fairfield in Liverpool. It's more coming, yes. So and across the board, everyone's been very helpful. So Wollongong and Nepean put their hands up. So that's all going very well. So there's a lot of support from one another, which is good to see. And of course, we have these groups, social groups like this, and I'm sure you're doing a marvelous job connecting with everyone and providing support to the public. Like Harini said, mental health is quite a big thing now, and you people, I think you've been doing a lot, haven't you, since the start with all your forums. So I think it's supporting the community in a big way. What I'm not sure is how many people of which communities are you targeting. I think it's more the Liverpool area, they've been very fortunate. So maybe trying to spread out to the others is good. So I'm in touch with another group which has New Zealand and Sydney doctors, and this was mainly when COVID was big in India. So we were trying to see if we could help them out. So they're looking to see how people could help you. So Raji was helped and will connect with some of them. And if we can share ideas amongst other community groups, I think that would be very helpful.
Definitely. Sorry, I just wanted to go back to Avi for a second. Did you had your hand up before?
Oh, yeah. So I had a question for Dr. Harini, and I wanted to ask you about how, you know, when healthcare professionals feel that they're not doing enough despite doing more than enough in these times, and how important self-care is for health professionals in these situations where they are going through work overload and burnout, and also having this internal conflict of, you know, am I doing enough?
Yeah, look, I mean, that is always a question, and I'm questioning whether I'm doing enough, and I'm volunteering. I've been working at vaccine clinics outside of my GP clinic as well. There's always going to be that element of guilt, but you are doing enough and you've got to prioritize yourself, because like they say in an airplane, like if you don't look after yourself, you're not going to be able to look after other people. So something that I do as a young female GP, I tend to attract a lot of young teenage girls. And something that I do for them is give them a prescription. And it sounds really dumb, but it works. So my prescription for healthcare workers is you've got to look after yourself, and that means that self-care is a priority. And the way I suggest it is things that I say is you've got to take a walk every day, something where you move your body, because it's really easy to sit in front of a screen. And this is something that's applicable to anyone. Doesn't matter if you're a healthcare worker or not, because parents are going to be feeling this level of guilt as well. Am I doing enough for my kid? Am I actually providing them with enough education? Because now there's no teachers. Well, they're there. They're there to support you, but you feel like you're all on your own and there's no one to help you. So things that I say is, like you said, you've been doing the right thing all along. Go for walks, stay physically active. Doesn't have to be something where you're breaking a sweat. Ideally, that would be great if you could break a sweat, but go for a walk. It's 20 minutes. It's 20 minutes outside of the house. It's 20 minutes where you get to walk around without a screen. You can have a conversation, call your mum, call your dad, talk to your kids. The other thing that I would do is do something creative, whether that be write something creative, paint something creative. There's all you have to do is, you can't go to the stores, but Kmart, Officeworks, buy yourself some paint, a few paintbrushes and paper and paint something. There's a lot of online classes and tutorials. Learn a new skill and do something fun with your family. Take pictures, make it a challenge. So have a challenge where you have to take photos of a family member, set 5 things, say a family member taking a walk, family member playing a game, and a family member watching TV, and make that your mission. Like, give each person in the family a job or a task to do. Utilize the technology that you've got in your hands. Everyone has a smartphone. Make it a game. So self-care is important, and remember to take a break from work. Everyone's going to be, there's work will always be there. So always just take the time out to have a bit of routine. Go for a walk in the morning. If you need to go for a walk in the afternoon, go again. Get some sunlight, get some vitamin D, move around, and connect with someone, whether that be a friend that you haven't spoken to in 5 years, or like this, because I've jumped on this. This is my first time jumping on this, and I've come across so many family friends that I haven't seen in years, with the chaos of work, the chaos of study, the chaos of life. So reconnect. And hello to all the aunties and uncles out there that I haven't seen in ages. It's nice to see your faces and nice to see your smiling faces, and not normally something that I'd reach out and do. So use the
Adding on to what Harini already said, which is like a wealth of information and really good advice on the question that you asked. I recently came across this resource that I've shared in chat. And this is especially meant for healthcare professionals. You can probably go onto the link and have a look and explore it a bit more. Yes, and now maybe Rajiv and Wani, you guys want to ask your questions? Your hands are up.
Yeah, I can go first. No, thanks, Harini, for sharing all that information and being in, and also Sumana for her first-hand information. Being again frontline in Southwest Sydney in mental health, it's very clear that the mental health needs of the people have all gone up a notch. So those that weren't affected earlier are starting to get affected with sort of milder symptoms. Those that were mildly affected are now moderately affected. Those that are moderately affected are more severely affected, and those that are sort of severely affected, it's become pretty catastrophic. And even those that sort of need to come to hospital, and I think there's I don't know how many of you saw the Sydney Morning Herald's sort of article from the chief psychiatrist today, Murray Wright, about 40-50 kids presenting to emergency departments with sort of significant self-harm and suicidal behaviors. That is in fact a significant underestimate. So for the whole state, Campbelltown is the second busiest hospital for kids with mental health problems. Kids Hospital Westmead is the busiest in the state. And so between Western and Southwestern Sydney, we just have such a significant population of families. Children sometimes are like the emotional thermometers at home, and there's quite a lot of quite significant difficulties that are coming up. Similarly, with the lockdown, there are other kinds of sort of really untalked problems and difficulties that we see, including sort of higher rates of domestic violence, higher rates of abuse, and these kinds of abuse may not be very obvious. Sometimes it could be just significant negative emotions within the family setting. And again, we're not all programmed to be with perhaps different members of the family for such a long extended period of time without having any sort of downtime or art time, or and even that can set up some negative cycles of relationships. And I think it's really important to understand that everyone needs their own space. Everyone has their own way of having an out and looking at what can be done. In terms of the situation itself, yes, we are seeing a large number of people come to hospital, or we return a positive test, and in a sense, the numbers that we see are only the numbers that have been tested and positive. It doesn't really reflect the true number of people that do have the virus in the community. And much like, and I think it's to a significant extent, it is a smaller version of the second wave that was there in India. And again, I think the only good bit is that the number of older people who've been vaccinated is far greater, and so therefore we're seeing less number of deaths. Obviously, over time, the virulence of the virus will also be a little bit less, and that's helpful. And yes, younger people, and younger people continue to be significantly mobile. And so I'm sure you'd have noticed that the government have made sort of subtle changes in terms of how it's reporting these days. The venues aren't reported anymore. Number of people in the community while being positive isn't being reported as much anymore. And so I guess it's understanding now that it's not really, we can't really always turn to government to bail us out. It's something that all of us have to take a lot more responsibility ourselves. And I think that's sort of shifting for us to do our bit, in terms of encouraging others in our communities to do what they can to help limit the spread, to help increase the vaccine uptake, and generally, practice some common sense and so on. So I guess those are the kinds of things. And also, finally, I'd like to welcome Surya. Surya is a very dear colleague and a psychiatrist in Melbourne, and I think with Bhargavi, they're looking to set up something similar in Melbourne as well. So welcome, Surya, and I know Vani is waiting. But if you just like to say a few words to the group, I think that would be good. And then we can have Vani. I'm so sorry, Vani, but it'll be good to just listen to Surya for a couple of minutes.
So sorry, can you hear me?
Yes, we can hear you, Surya.
Yeah. Just sorry, I just came back from the walking. I don't know, Melbourne has been in longest lockdown, and I think it was Bhargavi's sort of interest initiative. We wanted to start something similar, community group here. I think it's a very good idea, actually, because people ask us informally, but I think having a group like what you in Sydney is a very good idea. I've been actually, somebody was talking about what people have been doing about healthcare professionals. I think there's a number of initiatives. I think somebody mentioned health hand in hand, and similarly, a lot of things are happening with Doctors Health Program in Victoria and other activities we are doing here. But we're seeing a big spike in general mental health referrals. I'm sure with the child and adolescent, I think there's a big increase. But overall, I think everybody's books are full and not able to see actually that many new people, even after increasing what we're seeing. And we have reached almost capacity. So they're looking at other innovative models to increase that access to the mental health by giving more training to nurses or psychologists or other professionals to be able to give access. So maybe I'll just do some of these, listen from you, I think, to get how you're running these groups, so I can maybe replicate with Prakash and a few other people in Melbourne. Thank you, Raji.
Thank you so much for joining us today. Vani, did you want to share what you were saying before?
Yeah, so I just wanted to add a few things. So a lot of mental health professionals like psychologists don't bulk bill these days. So therefore it ends up on the GP's hands to do a lot of counseling, even if you do the mental health care plan for them. So there's that. Then there is also the issue, I can't inform you the importance of vaccination. I was speaking to Sarah Auntie today, and she was telling me there are people in our community who are not choosing to vaccinate it. Some are elder, some are younger. And because I've had patients with COVID, and I kid you not, we have people in their 30s ending up in hospital. Okay, and ending up in ICU. So, and it's a very difficult circumstance. You have a family or young family with young children, a father is sick in one hospital and mother is sick. What happens then? So having to navigate all those situations. So basically mom ends up in health hotel, then moves into hospital, the kids have to go with them. So and when I've had patients who had just one vaccine, they haven't had the full dose, and they are like sitting there going, I'm just annoyed that the police is knocking on my door every day. So you can see the vast difference. And so if you know of any family members, just share my stories. I mean, we can't convince people to take vaccine, but it is a big difference. And when we open up, whenever that end of October, which is 70%, it is going to be the pandemic for the unvaccinated. So that is the main thing here. And so that's what I want to say. So vaccines really reduce hospitalization, reduce, sickness in people. So that's what I want to share.
So get tested, get vaccinated, and those are the two things that are
and even if you have COVID, still get vaccinated after that. That's the thing, to just to make sure, I guess, to strengthen your immune system.
Definitely. I'm just conscious of the time because we have gone a little bit over, but I see Jason, your hand is up. Did you want to share something as well?
No, it's food for thought for the next session, though. I think there's a lot of intellects in here who give a lot of good information, right? And we're very respectful of that. We appreciate what you're doing. But you know what would really good as an introduction from next time from these intellects is to give us a normal day, I suppose day in their lives, though, where they actually come across a certain issue and how they actually come across it. I mean, how they cater it. Like it is, you've got kids at home, or you've got a frustrated day. Are you bringing work home and feeling frustrated about dealing with the household activities and so on and so forth? Because I think the messaging that you guys are giving is absolutely great, and we understand it. But I think to put it into perspective is if you, for the non-medical intellects, it would be good if you probably align with the people who go through it on normal activity without having the medical background, if you know what I mean.
That's a really great suggestion, and I think something we'll definitely take on board for the next session, which I think will be in 2 weeks' time. So that is the 11th of September. I know at the beginning when we were, going around and sharing how we were feeling and the highlights of our week and things like that, I definitely got the sense that that lockdown is starting to get to people, and it is a little bit of a it's a bit of a marathon rather than a sprint. So Kanmani has really kindly offered to spice up this session with a little bit more of a fun note to end on. So Kanmani, do you want to explain the activity that you have kindly put together for us?
Before I start, hats off to all the health professionals and those who care about community. I thought I can do a little bit to cheer you up. So I thought of just playing the game. I just want everyone to join. Okay, of course, it's like a kind of trivia, but the topic is going to be definitely interesting. I'm not going to tell you now. It's going to be interesting. And one good thing about it is you don't need to answer the question. All you do is just press the button. And even if you get it wrong, nobody's going to notice. So only you know whether you got it wrong, where you stand. Only that we just do only name and fame, not name and shame. The top 5 only can be displayed on the screen. Others you don't get to see. So let's start. Okay, I'm just going to share the screen now. Oh no, sorry. Okay, I want to just type in your Google search, Play Kahoot. I know some of you must be familiar, Play Kahoot. Now just do that, and then you will end up getting a box. which ask you to give the game pin and nickname. And I want people to give the original name because only then we can see who is the smartest. Okay, so I know this is going to be, I think people must be now seeing what I'm, oh God, what is happening?
Sorry, what was the game? The ID?
Kahoot. You can see the screen on the screen. Kahoot. K-A-H-O-O-T. Kahoot. You just put play Kahoot, and you will see a box which asks you for a pin number. I'm going to, so this pin is going to come in a minute. Okay, this is the pin 4683716. Now, please write your first name. That would be helpful. In case if you win, if you have the nickname, we won't believe you. Sorry, I'm a typical teacher. Okay. I have only 6 people joined in. 9. I think I should have about 20. Am I right, Chari?
Are you included in that, Auntie?
No, I'm not included.
So you'll have, should have 19.
Okay, 19, we'll see. What about others? I see only 11 names. Others have gone. Guys, if it is short, who cares if you make a mistake? Nobody's going to notice. It's fun. Just for a change. Because you are working hard, you always talk about COVID and all those things. This is a little bit different.
Yeah, I think good to start.
Okay, I'm going to start then, because otherwise it'll be like keeping people. I think, oh, I forgot to get the pin number. So, guys, I don't know Hindi. So I think the questions come on your screen. I think it's easy to choose the answer. Multiple choice, you don't need to think so much. Okay, I think 11, 12 anymore. Okay, 10 people got it right. That's good. Sri Devi, I think maybe they are Sri Devi fans. Oh, Jay is leading with 927.
Kanmani ji, can you please read out the question, because I'm like switching between screen, so I can't really.
Oh, is it not coming to your screen?
No, I can, but to answer that,
Look, some Hindi words I can't pronounce. Now I can say something. Yeah, because I don't know Hindi. Okay. Oh, Raghu is leading this time. Vani is second. Okay, I'll try to read. What is the running time of the movie 102 Not Out? Next time you can join in case if you play again, you can join using the laptop or something. Oh, 8 people got it right. That's good. We see who is going to be in the leaderboard. Oh, Raghu is still leading. Vani is second. Okay, next one. Guess this Bollywood celebrity. Oh, Amita. I may be wrong. I don't know anything really, to be honest. Oh, I got it right. Oh, Vani is leading, guys. Raghu, you have to beat her up. Oh my God, I think Raghu made a mistake, I think. Looks like it. Double points. Guess this Bollywood celebrity again. Two more. Only 5 people got it right. Kritik Roshan. Oh God, these different people. I like this. Okay. We'll see who is going to come to the lead board like at the end. Wow, who is this? Oh, I guess this is a Bollywood actor. Actor? Okay. Oh, you got it. 9 people got it right. Okay. Guess the Bollywood actor again. 10 people got it right. Suman leading the board again for 3 questions in a row. Name the Bollywood movie through the picture given. One more response. 11 people got it right. That's good. Sumana is still leading. Okay, Avi is following with 6,913 points. What does the B in Bollywood stand for? Okay, one person didn't get it right. Maybe they are new.
Did one person actually put Baghdad?
Yeah, I was thinking, how did they pick up that? Okay. Even when they are young, maybe they know only as Mumbai. I don't know. Sumana is still leading. Okay. What is the highest grossing Bollywood film? Which movie is that? I have no idea. I don't know anything. 2 more responses. Up we go. Okay. Only 6 people. Is it that one? I have no idea. Okay. Oh, wow. Avi is leading. Okay, good. See, I don't know who's going to come next. Okay, that's good. In the movie, I don't know, Tara Zameen Par, what did Ishan suffer from? One more response. I don't know, maybe, oh, okay, 10 people got it right. We'll see who is going. Oh my God, somebody is coming. The new names are popping up on the screen. Bollywood Indian film. Oh, makes more films annually than Hollywood. Is it true or false? Okay, one more response. I think there were 11 people responding. Oh, okay. Wow, Yash is coming third. Which legendary Bollywood icon is also known as the showman? Still 11 people. 7 got it right, Raj Kapoor. Okay. Wow, Sumana is leading again. So it's a competition between Sumana and Avi, I think. Okay, now we go. How many people watch Bollywood movies? I think they can 2 more answers. Nearly 1/6 of the world's population. Only 3 got it right. That's the just like same people on the board again. Come on, someone else. Oh, Bollywood make movies in what language? Okay, that's good. I think only 10 people. So they are still leading. Oh dear. Okay. Which of the following are Bollywood movies? There are 2 answers, but you may have to pick one. Only 5 people got it right. Okay, Sumana is still leading. Avi is coming second. What is Bollywood? Okay, now 11 people got it right. Everyone got it right. That's good. Double points. What is the average rate of Bollywood movies made per year? How many movies they make in a year? How much is this? 10? 800 movies. Wow. Okay, next. What is Bollywood usually about? Nine. Okay, that's good. How many more? Oh, 20. What are Bollywood's difficulties? Seven people got it right. Oh, third person is Jay now. This position is changing slowly. Who is not a Bollywood singer? Oh, except one good. Everyone got it right. That's good. Okay. When was the first Bollywood film created? The first movie. Eight, 22 got it right. Okay, Avi second, Jay third. Guys, others, please try to come to the leaderboard. The following is the sister of which Bollywood actor? Only 8 people participating, 9. We can expect one more answer. Okay, only 4 people got it right. What is the most repeated sequence in the movies? No response. 9 people got it right. Oh man, this position is like the top 5 is going to be the same people on the board. What famous Bollywood family is shown? That's easy. Someone didn't know, even I know that. Okay. Double points this time. Which movie has Amitabh narrated? Oh, all of them. I know everything's right. I didn't know. Oh, look at this. It changed now. 3, 4 more questions. One of the 4 countries Bollywood is the least popular in. South Korea. Oh, didn't know that. Chari, you come here. You watch Korean movies. They don't even
got
watch
that question right.
movies. How sad it is.
Welcome to the lead board.
For the first time ever. I've been stuck in like 10th place.
And you watch Korean things and they don't watch Bollywood movies. How sad it is.
Yeah, no, we did a swapsies. I watch more Korean stuff than I do Bollywood.
Yeah. Which of the following movies didn't receive an Oscar? Only 3 people got it right. We'll see anything happening with the scoreboard. Oh,
Vani took my spot.
I know. Maybe the speed. 2 questions, guys. You still make it to the leaderboard. How many Bollywood cinema tickets are sold on average each year? Oh my God, it's all billion and. Any more answers? One more. 2.6 billion. Okay, this is acknowledged to me now. Okay, I think last question, I think. Who is Zaro's favorite Bollywood actor? This can make a difference. Someone's name can come in the score. Top 5. 7 people got it right. Okay, we'll see who is on the podium. Okay. 20 out. Jay came 3rd. Who is 2nd? Avi 2nd. Sumana, is it Sumana the name? Sumana 1st. Congratulations, guys. The runner-ups are Yash and Vani.
Who's Zaro, by the way?
Guys. I hope you had good time. Look, maybe next time if I have a chance next time, probably I'll make a different one because I'm not good at Bollywood items. But anyway, I managed to do certain things. Okay.
Thank you, Kanmani. That was actually really fun.
No, I wanted to select pictures, scenes, and songs and stuff, but some of them that they removed the pictures. So without that, the question is not makes sense. I took something else before and I tried to play and see what happens. All the pictures is removed, the videos are removed. I don't know whether it's interesting. I know something to laugh about.
It was lovely.
Guys.
It was great.
Oh, thank you very much. Highlight of the week.
There's a new highlight.
And I mean, just put your thumbs up or
We
hands up
need to
and see
leave.
whether
We
there's
need to
any
leave. The other
support
one,
or
other
I
meeting
did
is
waste
starting.
your time.
Okay, I'll end up the meeting because I think there's another meeting that needs to start. But we'll see everyone in 2 weeks' time.
See you guys.
Thank you
Bye.
all.
Thank you,
Bye-bye.
everybody.
Thank you.
Thank you.
Bye.